my team. So we have for the said webinar, we have PJ Sales, Paolo Villanueva, Charmy Aquino, and we also have Dr. Pedrito Tagayona. And we are under Dr. Junin Chong, our professor in special topics in health informatics. And we welcome everyone to our first local AeHIN hour for the Philippines. So AeHIN stands for Asia eHealth Information Network, where we talk on various topics concerning technology for health. And the current time is 11:02 a.m. That's Philippine Standard Time, and we are broadcasting from the University of the Philippines, Manila. So before we start our session, let's have a quick orientation on how we can make the most of our presence today. So we are very privileged to have access to Cisco WebEx. So thank you, Aliyah. Oh, by the way, Aliyah Evangelista is the Secretariat of AeHIN. So if you are encountering problems as you participate, you can try to log out the session and then rejoin the meeting immediately. So you already have your meeting room IDs and passwords. The microphone will be on mute during the meeting. If you have questions, you can type in the chat box that you can see on your screen, located at the right-hand panel. And then there's also a hand button that you can use to raise your question directly to our speaker. And as the moderator, we will give you a signal and we can unmute you so that you can ask directly Mr. Mohammad Ullah. So we're done with the introductions earlier. For those who haven't started or haven't introduced themselves, you can type in your name and your designation in the chat box so that we can properly address you. So, Aliyah, can you hear me? Aliyah?
Yes, anything?
Sorry. Yes, just want to ask, we are still going to proceed with the photo session, right?
Yes, but that will be done after the meeting.
After, okay. So yes, just a reminder, we will be on standby at the end of the webinar so that we can have our photo session to document our virtual presence for this AeHIN hour. And we are going to send you out evaluation forms for the said webinar. So as mentioned, we are very privileged to be part of the webinar series with our host, Aliyah Evangelista, who had helped us to make this webinar possible. Okay, so let me have now my introduction to our speaker. So our speaker for today is the Technical Advisor for Health Information System at DHIS. He is an IT professional with healthcare domain expertise. He started his career as a programmer and a business intelligence analyst. He is providing technical support to the Ministry of Health and Family Welfare in Bangladesh since 2010, with a strong role on strengthening health information system. Currently, he's working with DHIS2, which is a District Health Information Software System 2, and has implemented in all health complex government health facility in Bangladesh. He is one of the core members who introduced software for the collection of aggregated health data using DHIS2 in Bangladesh, who also received a scholarship to attend the 2013 Open MRS Implementers. So without further ado, let us welcome Mr. Mohammad Ullah. Mr. Mohammad?
Hello everyone, good morning. I hope you can hear me. So if you face any trouble hearing me, you can type in the chat box. I'll start the presentation now. It is my honor to present the implementation of DHIS2 in Bangladesh. And I will also talk about the achievements so far we have and also the challenges that we are facing right now. Okay. So as Gilbert says that I'm providing technical support to the Ministry of Health regarding DHIS2 and OpenMRS. So first I will talk about how actually the initiative started in our country. First I will inform about the structure of the Ministry of Health in our country. The health system of Bangladesh is fragmented. That means Ministry of Health Family Welfare offers healthcare services to the citizen via primary, secondary, and tertiary care hospitals throughout the country up to the community level. And in the urban city, primary healthcare falls under the Ministry of Local Government, Rural Development, and Cooperative. In most cities, MOLGC does not have a network of its own health facilities and hence provides primary healthcare services in partnership with other NGOs. So, in 2008, based on a recommendation from Annual Program Review of Sector-wide Approach, DHIS agreed to assist the Ministry of Health developing a well-functioning health information system, which incorporates data sources from all the different levels of the health system. So, in 2009, an innovative and integrated approach towards HIS strengthening was started. And DHIS supported MOHSW to develop an electronic data repository for the national health data collected to the National Data Warehouse using DHIS2 version 2.0.1. The aim was to bridge the gap between fragmented systems by bringing together the data from various databases. The data warehouse provides rich data mining functions to generate reliable and accurate data which decision makers need to plan and monitor health interventions across all levels of the health system. This is actually the current scenario of the health data warehouse. There are several departments of the Ministry of Health, like DG Family Time, Director General of Family Planning, Director General of Health Services. Also, there are some sub-departments like NNS, TV, EMOC, INCI, and EPI. So they are actually using their own software and own database system. Like someone is using Excel, someone is using SQL Server, and maybe someone is using Oracle. So what we did was we collected the data from them, and then we developed a mapping table in Excel to merge all the data from different sources into a central repository. So we developed a data mapping table in Excel. Then we introduced ETL, extract, transform, and load procedure to input all this data together into one under one database. So now I will discuss about what is actually the ETL. At first, we were trying to develop the data mapping table manually by checking all the database and structure from the different sources. Sorry, I was having some trouble. So the ETL procedure was at first we are trying to develop the data mapping table manually. So we analyze all the data structure and the table from the different sources of the MISs, and then we put all this together into an Excel file. And then from that mapping table file, we are using ETL software named Talent Open Studio, which is an integrated tool, and we use that tool to map all the tables together into one database. But we were facing a few challenges regarding this. Like update of the mapping table is very time consuming, also a difficult procedure, and also there are lots of changes in the DB structure frequently from the different sources, and also there are some questions about standardization, and also there are some challenges like double reporting Also, there was a lack of manpower with relevant technical expertise who can regularly update this data mapping table. Also, there are some lack of initiative from the ministry to own this data warehouse. Also, there are some lack of interest on use of this information collected from the different MISs. Also, MISs are reluctant on sharing data. So that was the start, and that was the story about how actually the initiative started. So as part of this initiative, DHIS advocates DHIS2 customization for interested MISs. So Director General of Health Services (MOHSW) shown their interest, and DHIS2 was first customized for them for decentralized data entry in 2011. So at first, we introduced we started with three data sets, which is a monthly EMOC data set, emergency obstetric care data set, and monthly hospital bed statement data set, and monthly INCI data set. So now I'll request Gilbert to present the video, whether you will see why actually we have selected DHIS2 to implement in our country and how we are using this software for our country. Mr. Gilbert, can you please start the video so that everyone can see the video?
Okay, sure.
Hello, Gilbert.
Yes, can you hear me? Great. Now,
Yes.
Mr. Ullah, apparently, my apologies, I'm using a different computer. Is it possible for you to play the video on your end?
Yes, I can play the video. Give me one
Yes, my bad.
No problem.
So we're waiting for Mr. Ullah. So what we've seen from his slide would be technically the issues of Bangladesh. More or less, it's similar from ours. As you can see, they also have issues with double reporting, the standardization, updating mapping table, more on technical issues. And we also have issues with organizational from our policymakers, like the ownership of our Department of Health and whatever the type of health information would they want to implement. Mr. Ullah, Mohammed?
Okay, the video is ready. So now I'll start the video, and please type in the chat if you face any problem seeing the video.
All right, thank you. Aliyah, can we share Mr. Ullah's screen? There.
I think he's on. His slides are still arriving.
Okay, sure. Thank you.
Yes, Fatima, I think the sounds are not yet in, but we can see the video.
So you can only see the video, not the audio.
Yes. Would you try to do a share your application?
Yes.
Do you have
I already
slides?
shared the application.
Do you have a MP4 of the file or M, yeah, MP4 or a format within your computer? You can just share your file or share application, and then you can view, or we can view the video with its corresponding audio.
I have in WMV format, not in MP4 format.
WMV, I think that would be fine. You do share application on the left panel of your screen there.
Okay.
Your slides are arriving. We could see that panel.
Can you hear now?
It's loading in less than a minute. There, maybe you could click.
Welcome to the
There, we can now hear it.
In this video. So now everyone can hear, right? Okay, thank you.
Yes, as it appears.
Okay. Hello everyone. Sorry for the interruption. I'd like to ask again. Can you all please see the video and also can hear the audio or not? Please type in the chat box so that I can see who is not seeing and who is not hearing the video.
Hi, Muna. I don't know if it's about the connection or uh, the load, the how it is uploaded. Maybe you could do a demo. We see the video a while ago you posted on YouTube. Would it be fine if you do a small or a very short introductions on the features that is being mentioned in the video? Would that be fine?
Okay, I can demonstrate the real application. For the time being, I guess we can stop from here. So, okay.
Right. So I think that's it. While Muna is working on the video, or we could maybe start a discussion, or because the connection is still very the connection is at the minimum, and we hope that by the next 18 hours we will be able to increase our bandwidth as we partner with APAN, another group of individuals in South and Southeast Asia who are facilitating e-learning sessions in universities across Asia. Maybe, Gilbert, we could proceed to the discussion part.
Yes, actually the video should be to end the first part of the slides of Mr. Ullah. Mr. Ullah, should we proceed with our next slides? Or before we proceed to our next slides, do we have any questions? You can type in your question in the chat box, or if not, raise your hand so that we can unmute your microphone. Do we have any questions from the audience, please?
Okay, I guess everyone can type their questions in the chat box, and I guess it's better if we start the discussion at the end of the slide.
Okay, sure. Mr. Ullah, you can now proceed.
Continue?
Yes. Thank you.
Okay. Okay, so let me tell you briefly about why actually we have selected DHIS2 software to implement in Bangladesh. Actually, before 2009, as I have shown you that different MISs and departments are using different kind of software based on their environment and the load they have and the data entry points they have. They are using their own system. So the problem is, I've mentioned that standardization is one of the problems, because everyone is not following any rules or any standards to develop the software. So at the end of the result is no one is able to compile all the data together, and they cannot submit this to the ministry. So we were exploring to implement one software which can fulfill all the purposes, all the requirements from all of the departments. And also we were looking for some flexible tools, whether anyone can easily create their data entry forms and also can collect the data easily. So one exciting feature of DHIS2 is that a person with a simple HTML knowledge, the person can create a data entry scheme in DHIS2. That means the person doesn't need special expertise on IT to develop a data entry scheme. And also another good feature of DHIS2 is that DHIS2 provides strong reporting facilities with lots of graphs, charts, and other things, including GIS as well. So during that time, DHIS2 was the most open source, most powerful and open source software in the market. And we have selected open source software because then we do not have to deal with the licensing costs and other costs involved with the private software. So that the government can minimize the regular maintenance costs and other costs. So that's why we have selected DHIS2. And another important feature of DHIS2 is that this is web-based software. So anyone can log into this software via online easily, and also it is role-based. That means the user with a specific role can see only their part. So that's why I mean there are lots of other features of the DHIS2 which you can learn from dhis2.org. So that's why actually that's the history why we have selected DHIS2. So now the initiative started in 2011. We started with 3 data sets for the Director General of Health Services, and right now DHIS has 33 aggregated data sets. They are collecting data like EPI districts of EPI infant and women related information, also like IMCI information, PMOC information, and hospital bed information, and monthly OPD and emergency visit, etc. So this actually covered most of the health programs that is running by DHIS. So data is coming from all over the country up to union level. In our country, we have 7 divisions and 64 districts and 486 upazila. And under this upazila, we have 4,501 union level health facilities. So data is coming from each of these levels. And also we have introduced 3 individual data sets. Another important feature of DHIS2 is we can collect individual data from the facility level. Like currently we are collecting 3 data sets, maternal and child health care census and death registry. So this data is coming from 13,000 community clinics. Currently, we have the second largest implementation of DHIS2 over the world. So this is actually the individual record collection system which we are using right now. So as I have mentioned earlier that we have 7 divisions in our country. So as we are densely populated country, so there is a lots of load and data transaction from each level of the country. So we have some resource constraints like low bandwidth, also that is not available everywhere. So what we have decided is that we will set up 7, one server for each division, so that the server can easily handle the data in parts and also can balance the load. So data is coming from the community level using laptop, using tablet from the community clinic, and all the data is coming into each 7 divisional servers. And the data is coming on a daily basis, weekly basis, monthly, and also 6-month data. 6-month data is also coming into the divisional servers. So at the end of the month, we collect all the data from these 7 divisional server and integrate into the central server. Previously, I have showed you the individual data collecting procedure, and now I will discuss about how we are dealing with this aggregated data collection system. So aggregated data is mainly coming from Utula Health Complex, government facilities, medical college, and other facilities of the government. And they are entering data monthly, daily from their institute and using computers. DHIS have calculated computers to everywhere so that they can easily enter the data. And this data is coming directly to the central server. So I'm repeating again. The community clinic the data from community clinic is coming to 7 divisional server and then aggregate to the central server. And for aggregated data, the data is directly coming to the central server. And everyone has their own username and password to enter the data. And where the data we are collecting, we have a DHIS public reporting server, whether anyone can visit and see what are the data we are collecting. So I am inviting all of you to have a look on the data that we are collecting from this reporting server. So from the central server, we shift all the we transfer all the data from central server to this DHIS reporting server, so that anyone can see what kind of data we are collecting. I'll share you the link at the end of the presentation. So that's the plan. Actually, we are planning for the future. Is that the data is coming from 7 divisional servers. We will monthly integrate those into the health data warehouse, and also we have some data from central server, and we will integrate all of this data to health data warehouse. And then from this health data warehouse, we will publish all the data for public view into the reporting server. We have implemented this all over the country, but still we are facing few some implementation challenges that I will discuss now. We have a huge population, like greater than 150 million in a small area, which contributes to high patient load. In a hospital, there can be 4,000 patient load per day for a 900 bedded hospital. That is also a fact in our country. Also, we have resource constraints like financial constraints. Also, there are some technical problems like high cost of bandwidth. Still, internet is costly in our country, and also there are shortages of skilled IT person in the ministry and also in the root level of the country. Now I'll discuss about a few technical problems or challenges that we are facing using DHIS2. Though it's an open source software and also it provides lots of features, but we still have few technical issues like the synchronization of the data from different servers to the central server. We are using data mart and data analysis and data mart to aggregate all this data. Right now, we have scheduled this for daily basis, but actually, the data we are collecting a lot of data, and running the data mart daily basis is a bit difficult for us, and because the server we have to keep the server shut down for few hours to do that. So we need more provision like weekly and monthly basis data mart scheduling. Also, there is no archiving option in DHIS2. So these are the most technical part that we can discuss in future about regarding advanced DHIS2 presentation. So actually, though we have a few challenges, but there are few opportunities as well. In our country, most of the people are using smartphone, and also use of smartphone is increasing in everywhere, and internet is also available and spreading to all over the country. So far, we have 110 million subscribers since September 2013. Also, in our country, mobile companies have introduced 3G services. So I guess will improve the accessibility of internet from the root level of the country. Also, our infrastructure is developing, and also joint communication is also growing. And the most important part is the government is much more positive on strengthening HMI software in our country. That's a big plus, and the success we achieved so far is only because of the cooperation and commitment from the government. You can visit the implementation of the DHIS2 from the following link. Also, the last link provides the reporting server, whether you can see what kind of data we are collecting and what we are actually how we are doing this. So you can visit this link to see what we are doing. Thank you for attending the session. So please ask me questions if you have any. Please feel free to ask me some questions. Thank you, Gilbert. Now I will give the floor to you for the questions.
Very much, Mr. Ullah. So we have here a couple of questions from the audience. Let me first start with the question of actually this is from Aliyah. She's asking if the 13,000 community clinics, the total number of CCs that are in Bangladesh, or does this number represent only the CCs that have the capacity to perform daily, monthly entry?
Well, this is the 13,000 only community clinics who is able to enter data to the central server, and the DHIS have calculated tablets for them to enter the data.
Okay, thank you.
What's the next question?
Yes, the next question, Mr. Ullah, is this is from Dr. Bobong. He's asking if there is a scheduled server shutdown. Is it part of the maintenance? And if the internet service provider is free?
Actually, what I have mentioned earlier, that the one technical problem is the running of data mart. Because without running the data mart, we cannot see the chart and other things. So what we do is at the end of the week, like in Thursday, we start the data mart, and also we do the maintenance after the office hour, or maybe in the weekend. So in the weekdays, we try to keep the server live, and in urgent cases, we shut down the server for a couple of hours, and with communicating with all the data entry users. We are using Google for Gmail group for calculating for the communication and other things. So we have formed a group where the people email the problems they're facing also. So we announce in that email so everyone can stop the data entry now, and then after the server is live, then we calculate the email again.
I see. Now, follow up to that question, Mr. Ullah. When you say that you're sending the health data using email, how do you go about the security of the health information?
No, actually we do not send the data to the email. We actually communicate to that email. I mean, if anyone facing any problem, they send this to that specific email address, and then we answer them the question. So we actually using this communication method to communicate with everyone.
Okay,
and only the DHIS2 can, DHIS2, the person who have the username and password, only they can log into the DHIS2, and the DHIS2 is more a secure system as well.
Okay, great. So do we still have any question from the audience?
Hello, I can hear you. Hello.
Yes, do we still have any questions? We actually have a question from Philip Salas. He's asking if the if the data from the private hospitals or institutions are included or not in DIHS2.
Right now, that I have mentioned in the slide, that the government, the Ministry of Health have different departments. So right now, only DHIS is using the DHS2, and DHIS have the capacity to collect data from all over the country. Only the government Upazila Health Complex, government hospitals, community clinic, and medical college hospitals. So right now we are focusing on government, from the government facility, and we have a plan to collect this from the private clinic as well. Right now, only the government part.
Okay, so we still have some questions here. For another question from Dr. Bobong, he's asking if you were mentioning earlier about high government priority. So he's asking, is it in what form? Is it coming from policy making? Is it in terms of their budget or regulation? So basically the question is, what is the Ministry of Health in Bangladesh doing in terms of the implementation of DHIS2?
Actually, right now we are since 2011 we are focusing on implementing data collection procedure. So the data collection procedure is now, I mean, the implementation is now done. So now we will focus on the improvement of data quality, and then the government will use this information for policy making, budget, and also for other regulations. Other regulations. So right now we have done with the implementation and the data quality. So we will focus on data quality now, so that this information can be used for policy making and budgeting.
That Mr. Ullah. Again, we have another question here. Mr. Salas is asking, who is managing the healthcare network infrastructure? Is it the Technology Communication Government Agency or your Ministry of Health?
Actually, is it the network infrastructure? Do you mean actually we are what we are doing is we have developed a data center inside the Ministry of Health. So and also there is we are getting internet, I mean high speed internet. We are buying, I mean Ministry is buying internet from the ISP. It's not free. So and people from the root level, they are using modem, mobile modem, internet connection to enter the data. So actually this is the overall internet network infrastructure, and Ministry have lack of IT capable people who can manage these things. So from GIZ part, we are providing the technical support, and also some groups from UNICEF, ICDDRB, and other organizations who provide technical support to the Ministry. And also in the meantime, we are building the capacity of the personnel of the Ministry of Health who are directly working with Ministry. So we are providing continuous on-job training to them so that they can handle this thing. And currently, 80% of the tasks of the DHIS2 have been handling by the staff from the Ministry.
Now, Mr. Ullah, I actually have a personal question. Not really personal, but my question. This is in regards to your slide earlier about the technicalities or the technical difficulties that you're having in the implementation of DHIS2. So coming from that, you were mentioning that there is no scheduling and there's no metadata synchronization. have you taken any steps to resolve these technical problems?
No, actually there is some scheduling. I mean, there is a feature for scheduling of data lines and data mart, which is on the daily basis. I mean, DHIS provides support only daily basis data scheduling, but which is that's why I have mentioned, which is a bit difficult. So we need weekly and monthly basis. As I have mentioned, DHIS2 is an open source software. So if we want to do and also we are communicating with the DHIS2 open source community regularly, so that we can use the latest version of the software in any time. As I have mentioned earlier, we started with DHIS2 version 2.0.1, but right now we are using 2.14. So we are gradually updating the version of the software because we weekly communicate with the open source community. So actually, to solve this problem, I mean to add a functionality for weekly and monthly scheduling of data analysis, we have already communicated with the DHIS2 open source community and address the problems that we need to solve soon. So this will be done in the next version of the DHIS2, I guess so.
Right, thank you. So with the interest of time, we are going to have our last question. This will come from, actually he's our professor in special topics in health informatics. We have Dr. Inchong. Aliyah, can we have Sir Inchong on mute for his question, or do you want me just to read it? Hello? Okay, so let me just, oh, it's not working properly. Okay, let me just read Dr. Inchong's question. So he's asking if, how do you ensure data integrity across all points of data flow? Because you were mentioning earlier that data quality is being focused on, and have you already identified methods to address this data integrity?
Okay. So actually, to solve these issues, what we did is we formed a monitoring unit with the staff from the ministry who continuously check the report from the dashboard and other reporting using other reporting features. So this monitoring team is responsible for checking the data is coming regularly or not. And if the data does not come from the specific facility, then they communicate with that facility, and also they regularly monitor the data quality as well. For example, recently we are seeing that some reporting cases of male abortion cases that they found from a facility, and immediately they have contacted with that facility and informed that problem. And this is the actually mechanism that we have developed to ensure the quality of the data, and also the quality actually will improve by the if the use of the information started. So that's why we are now more focusing on the use of this information that we are collecting from the different levels. So that's why we have opened the data for public view, and any researcher and any person can start research with this data, and we are hoping that gradually by increasing the using of this information will increase the quality of the data also.
Ullah. So again,
Okay.
So with the interest of time, I think we are almost ready to wrap up the discussion. It was a very fruitful discussion. Now let me just give you a summary of what transpired for today's webinar. Again, we have Mr. Ullah, the Technical Advisor of Health Information System, and he discussed an overview of DHIS2, which is the District Health Information System. It is a tool for the collection, validation, analysis, and presentation of aggregate statistical data. He presented to us the difficulties or the issues that they have in their Ministry of Health, and what are the steps that they've taken in order to at least resolve the issues. Okay, so we actually have him on screen. Also, he mentioned about the problems or challenges that is similar to the Philippines. That that would be for the standardization, double reporting, which I believe our Department of Health is already taking initiative as well with the use of ICT in terms of e-health. We are also gathering the same information such as IMCI, we're also getting that. And he mentioned that the most important feature of DHIS2 is being an open source software because it minimizes cost. And we have questions about security and data quality and integrity, which has been discussed further by Mr. Ullah. Now, for the references and for the slide presentation, we will be sending you out after the session. So we'll be, so please check your emails. We are also going to send you evaluation forms for the feedback of the session, and then we'll be waiting for your responses. We'll be sending out as well the slides of Mr. Ullah, as well as the links for the video and the DHS implementation. You can see on your screen the references of his slides. So again, we are very privileged to have Mr. Ullah. Again, thank you, Mr. Mohammad, for accepting our invitation to be part of this webinar.
Thank you, Gilbert, for inviting me to present the implementation of DHIS in our country, and it is my honor to present my country. Thank you. Thank you, everyone.
Thank you also to the MSH students who organized this local AeHIN Hour for the Philippines. As Gilbert mentioned, they will be sending you an evaluation form and the meeting slides for this afternoon. For further questions, you can channel it to the group of Gilbert for this AeHIN Hour. And contacts will also, I think, be established by Gilbert for this team. So I thank you very much for gracing this morning's AeHIN Hour. We will no longer do a photo taking sessions because we are too jam-packed this morning. I would just like to take this opportunity to invite you all on March 27 for the Health on the Net 2020. This is an activity supported by the Asia eHealth Information Network in celebration for the 20 years of the Internet of healthcare on the internet in the Philippines. I'd also like to invite you after March, HealthNet 2020 will be broadcasted via WebEx on 500-seat account, so we can accommodate everyone. And this will also be participated by international attendees. So I would be I will be coordinating with Gilbert on the meeting details. So that you will be prioritized to attend this Health on the Net 2020 because this is specifically a celebration for the Filipinos on the existence of healthcare on the net. And also, I would like to invite you on March 28, another activity for our regional AeHIN Hour with Dr. Shimizu discussing telemed in Asia. So that's it. Thank you so much. Thank you also to Dr. Godofredo Inchong for coordinating with us and our team in Asia eHealth Information Network for this meeting. So thank you so much. We see you on March 27 and March 28 online.
Right. Also, thank you, Aliyah, for the assistance for this webinar. So again, thanks for joining until the next AeHIN Hour for the Philippines and all the regional AeHIN Hour that will be hosted by Miss Alia Evangelista. So you enjoy the rest of the day. Thank you.